Hello, good morning.
Good morning, James. I'm going to ask you to introduce yourself and your profession, please.
Yeah. So my name's James Duggan. I'm a music therapist. Sometimes it's called music psychotherapy, but for my role, it's called music therapy, and I work full time for the trust.
Amazing, thank you. And can you tell us what a music therapist is?
Yeah, absolutely. So music therapy is very specialist. So I'm sure there's probably quite a lot of people who might have a little bit of an understanding, but maybe don't fully kind of understand the depth of the work. So I suppose the long and short of it is music therapy is a specialist therapeutic intervention, often associated with psychology because we work psychologically. And really, we use live musical play and musical performance in various means to support people to meet therapeutic goals. So it's really wide ranging. We do things like therapeutic songwriting, we do improvisation, and I suppose the fundamental theories that underpin it is the idea that music is a language, music is a communication, and within a therapeutic setting, music is an incredibly valuable therapeutic tool to support people to kind of explore their emotions, explore relationships, maybe explore hardships they've had in their life. And through music, we can bring that kind of to the surface. And that offers us a means to look at it and help people kind of meet personal development goals through that process.
Amazing, thank you. And what would an average day look like for you as a music therapist in the trust?
Yeah, of course. So I work full time for the trust, but I've actually got two different jobs, both music therapy. So I work as part of one of our community teams for adults and adolescents with learning disability, but I also work for our inpatient service. So I suppose over the course of a day, I would probably see anywhere from between 2 and 4 patients or clients for sessions. And that could be working with a range of issues. It might be working with trauma, it might be working with communication, it might be working with emotions or mental health. And as well as that, I would usually attend various meetings. So music therapy is part of what we call our multidisciplinary teams. So most days I would attend at least one multidisciplinary meeting. So that could be just for one patient, or that could be for a whole ward of people I'm involved with supporting. We might attend safeguarding meetings. I do lots of training for staff about music therapy, and also I might do indirect work as well. So working with care teams. A lot of all the individuals I support at the moment have learning disabilities or autism or both. So I do a lot of work with kind of care teams around individuals to support them to kind of bring music into their lives and find other ways of using music as a means of communication with them.
Amazing, thank you. I'm going to ask James, could you tell us a bit about your career pathway? So how did you get into music therapy from the very start?
Yeah, absolutely. So it's probably a bit different from lots of other healthcare pathways, I imagine. So my background is unsurprisingly as a musician. So I've been playing music since I was a young child, since I was about 7 years old. I play a whole range of instruments. But I trained at what we call, so there's a specialist type of university you can go to if you want to train in musical performance rather than kind of study music theory, and they're called conservatoires. They're really specialist. They only take a very small amount of people each year. So I attended a conservatoire in Cardiff, and I did a 4-year degree in jazz saxophone. So at the time, I didn't know I was going to become a music therapist. I wanted to become a freelance professional musician. So I trained there. I worked as a jazz musician for a couple of years. But whilst I was doing that, I started doing some community outreach work with a charity, which was kind of, I suppose the premise was it was bringing the creative arts to people who may not be able to access that. So I did a lot of work with people with learning disabilities and autism of all ages. And I just saw the profound difference that music could make to them. So kind of then I hadn't heard about music therapy at the time, and I started kind of looking into it, and I thought, you know what, it'd be great if I could continue to use some of these skills I've got, but actually transfer that in a more kind of formal healthcare setting. And lo and behold, I discovered music therapy. So then I trained as a music therapist. So in order to become a music therapist, like any art psychotherapy profession, you have to do a master's. So I did a master's in Bristol, which was part-time. So that's a 3-year training course, and that gives you all the necessary kind of skills. It gives you the therapeutic and psychological underpinning that you need in order to train as a music therapist. But also, whilst you train, you also undergo personal therapy yourself. That's a really important part of the process in order for us to understand how people are going to access and some of the challenges and barriers there are to engage in therapy. We also need to undergo therapy ourselves, and also to develop kind of really important reflective practice skills. So I did that, and then When I qualified, I worked freelance for a while. So lots of music therapists work freelance. However, there are contracted posts as well. There's probably not as many posts in the NHS as there are maybe in like the private and the charity sector, but it's certainly growing at the moment. There's much more funding available for it than there used to be. So I worked going into special schools for about 6 or 7 years, and I joined the NHS 2 years ago.
Brilliant, thank you. And I'm going to ask one last question. So, would you recommend music therapy as a profession for another person?
So absolutely, I love my job. It's a lot of training because it's so specialist. So you do need to have quite a high level of musicianship on at least one instrument. You need a degree as well as to do a master's. So unfortunately, it's not cheap. I think there is a bit more funding available than there used to be. So if anyone's interested, you could certainly look into that. There's lots of information on the British Association of Music Therapy website. If you type in BAMT, you'll find it online. There's loads of information there. But absolutely, I suppose all I would say is you need to be prepared and willing to learn a lot about yourself. We have to undergo therapy ourselves. For some people, that can be quite a challenging process depending on what's happened in your life. So I'd probably just suggest you need to bear that in mind. But I feel very lucky to have my job. It's very rare that I wake up and don't want to come to work. And certainly for my role at the moment within the NHS, I see the really profound difference it makes. So yeah, I love my role.
That's amazing. Thank you so much for joining us today, James.